that did not go according to my plan. So I have a new account, Grace Lam Chats. I was gonna do my IG live there. Then I realized that Instagram won't let me do an IG live unless you have over 1,000 followers. I have about 25 because I literally started this new page, new account 2 days ago. So hopefully Dr. Gabrielle Staniforth will see me on here. I think lunchtime IG live is pretty good because oh my god, here we go! Let's go! My
We
success.
did it!
Oh my god! So you know what just happened? Bloody Instagram won't let me start because I have less than 1,000 followers. I'm like, for fuck's sake!
Yeah, well, that's Instagram for you, isn't it?
I mean, I don't give a fuck how many followers I have. Even if I have one, if I can help one person, I'm happy. For God's sake, sort it out, Instagram. So that's my rant over. Welcome to my Grace and meNOTpause series.
Thanks for having me.
Well, before we
Can
go,
you hear me okay?
yeah, fine, totally fine.
Perfect.
I just went through your qualification,
Mm.
bloody nuts, with all your knowledge. And I was telling my audience that what I love about you is that you swear as much as me, which I love.
Oh, I was going to try not to swear today, but I mean, if you're happy for me to drop one, I might.
Oh, please do, because then then I don't look like an asshole. Okay, so let's go.
Yep.
Dr. Gab, give me your full name, your age, if you don't mind, and are you going through perimenopause, and what symptoms have you had?
Yeah, so my full name is Dr. Gabrielle Ruth Crownbuell Staniforth. It's a bit of a mouthful. I've got my maiden name in there now. I am 44, and it's hard for me to say whether I'm in perimenopause because I've had a hysterectomy. That's always the difficulty there. But I would say, judging by my symptoms, I am definitely in the thick of it. My symptoms range from night sweats, which come periodically, irritability and rage, emotional lability, and I do get the fornication, which is the formication, which is the ants crawling on the skin.
Oh my God, that's horrible.
That's me.
So are you on HRT?
Yeah.
So after you had your hysterectomy, is
Yep.
it straight away for people who don't know, can you explain a little bit of that process?
Yeah. So I had a hysterectomy when I think I was 39, 40, and I had it because I was suffering from really heavy periods. And I also had a lot of pain. I had a whopping great fibroid that I'd been battling with for a decade. And I think that was all flared up because I did do 10 years of IVF. So I had a lot of hormones pumped into me and it was quite large. So when I laid down, you could actually see the bulge of my uterus. So I was very uncomfortable. And on top of that, I mean, you can obviously hear that infertility is part of my story. So continuing to get a period every month was actually really devastating for me. So psychologically very difficult, an outward sign of something that I could never fully grasp. And so I put all that together and I opted to have a hysterectomy. So that meant a removal of my uterus, but left my ovaries. So it doesn't mean that I was plunged immediately into menopause because I still have ovarian function, and having a hysterectomy at that age doesn't increase your risk of having an earlier menopause. So I didn't need hormone therapy straight away, but I can tell you what, Grace, one thing that I really wish that someone had told me, and this is before I'd started any hard and fast menopause training, I wish someone had said to me, please track your cycle, not your bleeding, because when you don't have a bleed anymore, it's really going to come in handy for you to start to really figure out where you are in terms of your perimenopause and menopause. So I'm
One
kind
question,
of
could
in
I
the
ask a
dark.
quick question? I
Yeah.
mean, as a commoner, is there a difference between a cycle and just bleeding? I thought it's the same thing.
Well, no, because your cycle is your whole menstrual cycle from, day one to day 28, if we're looking at a regular cycle. Day one being the first day of your bleed, which is simply an outward sign of, hey, we're not pregnant. But during that whole 28 days, so many things happen in our reproductive system. So our lining builds up, we ovulate, maybe we get pregnant, maybe we don't. And then if we don't get pregnant, we have a period. But remember that what happens with a cycle, what we now know and what we should be acknowledging more is it's not just about the reproductive and fertility side of things in our uteruses, because that we're so much more than that as women. It's about what the changes of hormones are doing to the rest of our body, both from a symptom point of view and physiologically throughout that cycle. So does that make sense? Our outward bleed is simply a sign of where we're at in our cycle. It's not the cycle itself.
Right, right. Which I completely agree, because I track down everything. I'm just anal like that. So I
Good.
still have
You
got my
should.
like my pattern from 6 years ago. I mean,
Yes.
that's extreme, but I think when you are well equipped and if you're organized, then it just makes it easier when you go and see your GP.
100%. It's so much, that's such good information for you to take to your GP as well, because, you know, if I went and saw a doctor or me, they'd be like, well, where are you up to in your cycle? Like, I don't know. I'm really sorry. And I know I should have been tracking my headaches, and I should have been tracking my bowel movements and my night sweats and my rages, but I haven't. So I'm sort of clueless, which means that from a medical point of view, you're sort of in the dark as well. It's still doable, but the more information that you can go to your doctor with, the better.
100%. So people get on with it. So when did you start your HRT journey?
Oh, good question. Probably 2 years ago, I think. Yeah, probably 2 years ago. And I just started with some transdermal estrogen um, because of the night sweats. I think that's really what clocked it for me, because it's such a specific symptom of menopause. I think at 42, I was like, oh no, I'm too young. Surely that's not happening to me, even though I was practicing menopause medicine. But I guess because I was in that space, I was more sort of, I was noticing things a lot more. And then I chose to add in progesterone as well. I don't have a uterus, and historically, we've only prescribed progesterone to women with a uterus. But now that we have body identical progesterone and we know how beautiful and how important progesterone is for the body, it's most certainly appropriate to be prescribing it for women who don't have a uterus for the mood effects and mood stabilization and sleep. So I'm a really poor sleeper. As I said, one of my biggest symptoms is my mood instability. So I thought that adding in the progesterone would be helpful as well. And I've also tried testosterone therapy as well for low libido. I forgot to mention that one. But for me, it didn't make a difference. So I've discontinued that for now.
So how long
I
did you
also
try the
believe in, like, I should try. Like, if I'm going to
100%?
prescribe, I should try, right?
100%. 100%.
Yeah.
So how long did you try the testosterone for?
Probably for about 9 months.
Oh wow. And
Yeah,
because
and you've got to
usually,
really try it for 6 months.
yes.
It's a really slow burn. You've got to be on it for, I mean, from a medical point of view, we're supposed to sort of quote 3 months, but I usually say, honestly, if you haven't noticed anything at three, please do a 6 month trial. It's a really slow burn, and it's a really subtle shift. So people don't all of a sudden, smack into the bedroom and say, fuck me now. It's not like that at all. It's more like an inclination to think, have more sexual thoughts, or if you might not be initiating sex, but if your partner is initiating sex, where previously you would have been like, absolutely not, don't touch me, you're more inclined to go, actually, I'm okay with that. Let's give it a go. And of course, sexual function comes into it as well. So how easily you become aroused, and also the quality of your orgasms.
But as we know, it didn't make it onto the BPS, which
No,
sucks.
it
Really
sucks. It's
sucks.
BS.
I
But
mean,
hopefully, after you're chatting with Ginny last week, that was a great chat. Thank you for that. And hopefully they're doing a lot of work in the background to get that through. And I honestly do believe that it will get through, because the evidence is there, and we're making a lot of noise in the menopause space. So hopefully it'll be soon.
well, that
And
chat,
yeah,
actually, Mark Butler, our health minister, and also Deputy Health Minister Rebecca White, their team saw it.
good.
So, because I tagged them in everything, so they saw every single one of my story and stuff. So hopefully they will, get into action about that, because it's so unfair that men've got not 8 and then we've got none. We only
Yeah,
want one, for God's sake.
yeah.
And it's already
I had a
approved by the TGA. I don't understand. So Dr. Ginny pointed out something really interesting that I didn't know, that she said that even with men testosterone, it's very hard to get on a
very
PBS.
hard, very hard.
So how the hell did they get 8 on there and we
Yeah.
don't get one?
Yeah, well, it's because they're men. I'm sorry to be a feminist, but it's just that's the world we live in, unfortunately. And we're still clawing our way back.
It's so ridiculous. It's 2026, for God's sake.
I had a
Mr. Mark
patient this
Butler,
week
Rebecca
who,
White, please do something about this.
yeah,
It's
I was
just
on a
really
patient
unfair.
this week who's on testosterone and requires a higher dose. So is going through the tubes. Usually, if you're on the standard dose, which is zero point 0.5 mils, the tube will last you about 3 months, which at $120, that's about $40 a month. That's okay for a lot of people, but this woman needed twice that amount. That's $80 a month. And she had to say, well, I can't afford it. So she had to forego something that is really working for her. And remember, it's not just about libido.
Oh.
Libido is a mood. And if we don't have that libido there, it's going to be affecting our mental health and our overall quality of life. And remember, like, if we're going to be boosting all the men up with all of their, erection medications, who's going to be servicing them if the women don't have a libido?
No,
Anyway, it's ludicrous.
it just does not make sense. I mean,
Yeah.
it's just ridiculous. So let's get into our main topic today, transgender
Yeah.
with hormones. So
Mm.
interesting. And I have no idea how to even vent the whole transgender area because it's a very sensitive topic to some people, not to me. And I really
Mm.
want to talk about this because I want people to normalize this talk. And I
Mm.
really love the fact that I'm all for people being themselves, period.
Yes.
Right?
Yes.
And I don't understand why is that such a taboo topic to some people because don't we want everyone to be happy and just be themselves? That's my thing. So can you explain from the beginning what is
Mm.
CIS? What does transgender mean for people who don't know?
Yeah. So that's actually a really interesting and very good question. I guess when we're looking at terminology, it's important, I guess, to understand that cisgender means someone who aligns with their birth identity. And a transgender means that they don't align with the gender that they were given at birth. So a trans man was assigned female at birth, but identifies as a man or a boy, and vice versa for a trans woman.
So do you have a lot of trans men or trans women coming to your clinic?
I have more trans women coming to my clinic, so people who were assigned male at birth but identify as women. And I think the reason for that, Grace, is because I work with women and my expertise is in prescribing feminizing hormones. I do have some trans male patients, and I'm learning more about that. I must say that I would say that none of the doctors are experts in trans medicine. It's the trans folk that are the experts, and they're teaching us a lot because we just don't have literature, enough literature or evidence out there to say what we really should be doing. But yes, I do. I'm so humbled to have that clientele coming through to teach me their experience, and I'm really happy that I can help them be themselves.
So what is a very common question when they come to your clinic and ask you to help?
Can I
Like
take
how
hormones,
do
I
they want
guess?
to how do they want to improve their life
Yeah.
in terms of their sexuality?
So it's important to say that gender and sexuality are different, and that's something that can often be mishmashed. And that's something that my first trans patient taught me, the difference between gender and sexuality. And it should be, while there is an overlap, it should be considered differently. So when we're talking about gender and when people come to talk to me about gender incongruence and gender dysphoria, which is when you're not aligned with the gender that you're assigned, but you have distress about that, and that's the diagnosis that's required before you can go through and have hormone therapy or surgery. So I guess the biggest thing that people present with is the fact that they have this, well, it is a really deep distress about having to live in a body that they don't align with, and they 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 want nothing more than to feel like themselves. And their biggest question is, can you help me feel better about myself and kind of come into my body and feel like it's where I belong. And how do we go about that? Does that answer your question?
Yeah, I mean, we hear lots of stories about, transgender women and men when they don't get accepted by their families, because I guess a lot of parents might not understand that well, or they might be in disbelief. I mean, I'm sure there's some parents who are very supportive as well. But the stories I
Yeah.
hear most of the time is how they get ostracized. And I
Yeah.
feel so sad for those
Yeah.
children, because all you want to be is, all of us just want to be ourselves. And why
Yeah.
is it so hard for society to accept that?
I look, I totally agree with that, Grace. I don't understand it. And I would say that half of my patients come through with their parents or with their partner. And so they have that lovely accepting environment, but the other half come through alone and have fractured relationships, or they haven't even disclosed to their families what they're doing or who they truly are. Which, I mean, I would have hoped that in this day and age we've come further than that, but we really haven't. And you've got to remember, Grace, as well, I live regionally, like I live in regional New South Wales, so it's even worse out here, that we're still very much archaic in the way we think, a lot of country folk. And I think it's a lot harder to come out, whether it be with your sexuality or your gender, in a country town, especially when everyone knows everyone. You can't really hide, and the community is small. So to find like-minded people to support you and guide you through that journey is a lot more difficult. But it's still difficult in big cities as well. We should be doing better, and having conversations like this really is so helpful. Going back to something that you said at the beginning of the conversation about, you don't understand why people are ostracized, and why it's so difficult. I think with any difficult conversation, whether it be about, transgender sexuality, menopause, abuse, that's another big one. Um, it's not so much that the people who are living that experience are uncomfortable or don't want to talk about it. It's that the people who are receiving the information, they feel uncomfortable with it and they don't know what to do with that information. And one thing that I've learned from my patients is to ask questions and be really open and vulnerable about what you don't know. Just say, oh, I still remember my first patient, Chuck, beautiful. Um, if I just said, I've never done this before. Can you teach me? What do I need to know? What language do I need to use? Can you help me through this? And from that, I developed a real, I guess, sensitivity and passion to continue on in that, because the things you learn are just so inspiring. And that's what gets me up every day.
I mean, and also having good listening skills is really important for any kind of sensitive topics, or any topics basically, because
Mm.
a lot of people are not good listeners, sometimes myself included, because you just want to jump in and give your point across. However, I think with stuff like this, when clearly the minority of people that understand this topic, that we really need to really listen to people who are going through it. As you said, we need to learn from them so that we can expand our knowledge of how to help them, right?
It's
And
the
what
same with
happens?
menopause. Like
Yes.
we're the ones that are experiencing it. And I can sit there and know what I know from a medical point of view. But Grace, if you sat in front of me and you're telling me your experience, I don't know your experience. And who am I to say that that's not the truth? Your experience is your truth. So I need to work with your experience and your truth. And I think that as a medical community, we are doing so poorly at that. We're pushing our own agenda. This is what we've been taught or not been taught, and this is what, we have to do. And I'm not allowed to do that, or you're not fitting in a diagnostic text, box. And it's just, we've got to start viewing everybody as individuals and not as a diagnosis or a number or an age or a sexuality or gender.
So we live in Melbourne, and we've only been here less than a year. And sometimes, there are a lot of, colorful people here. And whenever we see a transgender woman, my son will ask me, he's only 12. He said, "Oh, Mama, is that a man or woman?" I said, "She's a transgender woman." And I said, "Isn't it lovely that she can walk out like this and be herself?" So
Yeah.
how you parent the younger generation is so important of how
Mm.
they see the world, right? Because my son doesn't even bat an eyelid anymore because he understands that, oh, that's quite that's normalized in our family.
Yeah, I think generationally it would have been, shh, don't say anything, don't be so
Yes,
rude, we don't talk about that, they're
yes,
abnormal,
yes,
that's very strange.
yeah,
So I agree. Like I've got children the same ages as yours, and it's very normalized and celebrated.
yes.
Wear what you want to wear, you know, be what you want to be. Yeah.
We were in a restaurant in the CBD, a restaurant that we always go to for afternoon tea, and there was two transgender women next to us, and they both look so fabulous, and one
Mm.
of them is a little bit more masculine looking. When we left the table, I deliberately, because everyone was looking at them, just kind of very judgmental. And before we left, I went up to them and I said, "You girls look so fabulous. Keep up the good work." And they were so shocked that I did that. And sometimes we all need encouragement. When you put yourself out there, of course you're going to get judged. Even like me, I get judged all the time, but that shouldn't be something that stop you from being
Yeah, and it
yourself.
takes confidence to, I mean, how much confidence would it have taken for those two women to step out and sit in that cafe knowing that they were going to be judged? And it just,
Yeah,
yeah, it's dreadful.
yeah. Can I ask you, when a woman had operation or vice versa, would a woman still go through menopause? I mean, these are very silly questions, but I'm just
Mm,
so curious. How does
mm,
it work in terms of perimenopause and
mm.
menopause when it
Yeah,
comes to
it's a good
transgender?
question. So I think if we keep it really simple, 100% of people born with ovaries will go through menopause, whether they be cis women, whether they be non-binary, or whether they be trans men. So menopause is when we lose ovarian function and we no longer ovulate, produce eggs, and we no longer produce hormones of estrogen and progesterone, which has significant effects from a symptom point of view because these hormones affect every cell in our body, but also from a physiological point of view. So these changes happen inside of us which don't make us feel anything. For example, bone density losses or changes. For people who are non-binary, they might choose to take a little bit of testosterone, but not to male physiological levels. But that still could result in menstrual cessation, so not getting a period anymore. And for trans men, some of them don't take hormones, but those that do take testosterone usually take them to male physiological levels and will inevitably end up not getting a period. And that testosterone will override, in many ways, what estrogen is doing in terms of how they're feeling and some physiological things as well. But when they get to midlife, the ovaries will still stop functioning. And even though the testosterone's on board, sometimes there are still new symptoms that can occur. In particular, some people do experience vasomotor symptoms, so hot flushes, although testosterone can help with that. One of the biggest things, though, Grace, is the genitourinary symptoms. So the vaginal dryness, the vaginal atrophy, and those changes. They're something that's really big and can actually happen with the introduction of testosterone therapy pre-menopause, but around that time can be exacerbated and become worse. So everyone will go through menopause. Some people will feel symptoms, some people won't. Everyone will have physiological changes. And that's really important that that conversation is acknowledged in the trans population so that they are aware that there's still preventative health activities, for example, protecting your cardiovascular health, protecting your bone health, that need to be had so that you can continue to optimize your health. It's really difficult, though, I guess, in the trans community because from a social point of view, the diagnosis of menopause is still very much orientated towards a cis woman's experience. It's still a very feminine thing. So for someone who is distressed at being labeled as feminine, would find the diagnosis of menopause quite uncomfortable. It needs to change. It's still like the diagnosis is still menopause is 12 months after the last menstrual cycle. That needs to be abolished, not only for women, but also for trans people, so that they have an opportunity to educate themselves around midlife and beyond and optimize their health so that they're not missing out as well. Does that make sense? And does that answer your question? I sort of went off
Yeah.
on a thousand
So
different.
can I ask, so if a woman is a trans man, does some of them expect not to go through menopause? Is that the
So
mindset
are you
for some
talking
people?
about a trans male, so someone born with
Female. Yes,
ovaries
yes, exactly.
and now trans male?
Yeah.
Do they expect not to go through menopause? Yes. Yeah.
Oh,
They don't
oh,
know.
oh, really?
That conversation is never had, not from a medical point of view, because we don't know. Like there's there's literally no literature out there. It's terrible. And I think it's just not understood or talked about enough. So I think there's probably a combination of not knowing, a lack of knowledge, and also not wanting to know because that's uncomfortable. That's a female thing, and that doesn't align with their identity
Wow, it's so much to learn. I mean, we need to
so
help.
much.
We need to help these people. Honestly, it's just as bad as it is being a woman going through menopause, let alone someone with that transition. It just blows my mind. And do they? So if they go on HRT, is it you just use the normal way of like patches or gel, or is it like injecting hormones? How does it
Pretty
work?
much. So if we're talking about trans women, so people who are going to be taking feminizing hormones, yes, they will take estrogen, usually requiring a lot higher doses than what we use in menopause care, which is hilarious because there's so much chat about some people prescribing, high doses of estrogen, but in the trans world, it's like 4 times the amount.
Wow.
So there's different ways you can use the transdermal applications, gels, patches, the oral medication, which is, to be honest, the go-to because when you're taking such high doses, it's the easiest way to do it. Implants are available, but they're not approved. But a lot of people still choose to do them because they can stay in place for months and they have a pretty good effect. But I guess it's important to understand that's not TGA approved.
Oh, why
For
is that? Why is it not
it's
TGA
not it's
approved?
not regulated. So everything that's been TGA approved has been regulated. It's been tried and tested, and we know what dose does what. We know the side effects and everything like that, but it just hasn't. It's not regulated. It's sort of compounded, and so
Oh,
that's why. In the trans male population, there's lots of different ways to do that. Oh, sorry, I should also say that for the trans women, usually estrogen isn't enough to get you to the physiological levels of a woman. So you need to suppress testosterone as well with a blocker. But that's always a choice. So every individual will come in and you choose this specific regime.
so you
Um,
suppress testosterone. How do you do that?
with a testosterone blocker.
Oh, okay, okay,
So
okay.
there's a couple of different oral medications that you can take that block testosterone, which allows physiological levels of estrogen.
But
So testosterone is very strong.
do you suppress all of the testosterone? Because, women also have
No,
testosterone too.
no, no. And that's really important. You don't want to suppress it too much because it can then affect mood, it can affect energy, libido, and so forth. So you always want to try and keep that at a female physiological level. And it's a really fine balance to try and get. And some people choose not to suppress their testosterone because the side effects of suppressing testosterone they don't want. And it just depends on their particular situation. For men, there's heaps of, I mean, for trans men, there's heaps of options. Like you said, there's 8 different options of testosterone. You can rub it on. You can, yeah, there's lots of different injections. Yeah.
So when you speak about the high dosage of estrogen, which is because I'm on 75 mcg,
Mm.
are we talking about like 200s or are we?
Yeah.
'Cause-
So a 75 is like a moderate to high dose. So 100 micrograms would be a high dose. And the oral equivalent to that, you're looking at 2 milligrams. It's not a perfect sort of swap, 2 to 3 milligrams, depending on how you absorb it as an individual across the skin. So we usually dose up to 8 milligrams a day orally. So that would be, yeah, 4 times the amount.
wow, wow.
Yeah,
That's so interesting because, anything above 100 is like, oh my God,
exactly. Right. And so what's been really wonderful about working in the transgender space is that I guess it's taught me to be less nervous about estrogen because you can see that it's working in that population. And yes, there are still risk factors, but even in taking it at such high doses, we're not really seeing the blood clots and so forth. So dosing to 100 micrograms, which is, to be honest, I've probably only got 2 patients in my menopause community that are over 100 and only by just a little bit. It's very, very safe.
yeah.
Yeah.
I mean, that's modern medicine for you. Let's not compare to
Well,
like,
as women, we're used to having high estrogen levels, especially perimenopausal women. And so, if I have someone who's really quite young coming in, late 30s, for example, I'm not going to start them on a smidge of estrogen when they're used to running on higher estrogen levels. Um, you're coming off the tip of the mountain. You need to keep it there. But if I've got someone who's coming in and they're closer to 60, yeah, a lower dose is appropriate.
and do you always or do you usually advise transgender to take vaginal estrogen because of the dryness? And
Yep.
and do they accept that? Are they quite open about that?
It depends on the person.
Yeah.
It depends on the person. Sometimes any conversation, any reference to female bits is really uncomfortable. So that can be an obstruction to accepting therapy, even though it's such a simple, easy, and safe medication to use. It's not simple for a lot of people in terms of their psychological health.
So all the transgender people that come to your clinic or you've helped, psychologically must be very hard to accept themselves and know what's going on. I mean, apart from all the physical things that you have to deal with, I would imagine the psychological part would be a big way to deal with as well. Like,
Sure,
do
sure.
they?
Most people that come to me, though, they're good. Like, they're ready. They've been sitting with this for a very long time and they're excited. So they, you know, bounce through the door. Yes, they might be nervous, but like they're finally doing what they've always wanted to do. And they're usually in a really good headspace because they've come to that point. I think the time before that is incredibly difficult.
Oh, I can't imagine. Like, can you imagine being a teenager and know that you want to change
Mm.
sex, and you're going through? I mean, it's just too much.
Yeah, it's yeah,
It's just too much. How can I'm taking up so much of your time? How can
right.
society be less judgmental and trying to understand transgender people more? I mean, I know some people that are so against the whole transgender world, which I do not understand whatsoever. And these people are close to me, and I thought, why wouldn't you accept? I accept your shitty character. Why wouldn't you accept other people
I
for their
just
own
think
choice?
I think it's really naive, and it's just that kind of attitude in today's society is just it's just not good enough.
Yeah.
How can we how
how
can we
can we
make
help
it
them
better?
thrive?
I think that normalizing the conversation is really important. So what you're doing with your son, for example, if the question's asked, answer it. If you don't know the answer, find out. If if you're a medical professional and someone presents to you and you're uncomfortable with that, ask. Let them know that you've never been in that experience before, and that goes for the layperson as well. If you find that you've got a trans person in your in your school community or in your workplace and you're really intrigued, ask. you know that allows them to share their story, and it also lets them know that you're an ally, someone that they can go to. You're learning, you can then impart your knowledge onto the next person and call people out. Like, fuck it, if someone's being rude and they're not going to accept someone for their sexuality or their gender, that's not good enough. And I think it should be called out, not
Oh,
just
100%.
ignored. Like,
100%.
yeah, it's very old fashioned and naive.
So I'm going to round this chat up because I know you're very busy. And I want to make a TV K drama recommendation to you and everyone who might be watching this.
Ooh.
Is it just perfect timing? When I invited you to this chat, I was watching this K drama show called One Class. In this series is one of the best shows I've seen for the past few years, and it came out during COVID. I had no idea because I wasn't into K drama. Now I am. This show is 10 out of 10. So one of the
Wow.
character in this show is a transgender woman, and how they told the story was so inspiring and it was a really good lesson for my son to start learning about transgender people, because through a TV show, we were all watching this show and we loved the show so much. And I really like the way how they dealt with this topic. Very open-minded. There was a little bit, discomfort with how other people react in the show. Definitely watch the show because it kind of like a step for my son and
Mm,
I to start talking about this. It's
mm.
a great show. Ito One Class, please watch it.
Got it. I
It's on
will.
Netflix. It's on Netflix.
I will.
Um, Dr. Gabby, thank you so much for this. It's so inspiring what you're doing, and it's so rare as well. And I hope that, in a few months, few years' time, more GP will do what you do as well and help people who are in need, not only
Mm,
just normal people like us, for different kind of races, different kind of gender, because we're all equal.
100%. We're all the
Yes.
same.
Yes. Thank you so much for this. Now I'm going to try and save this, which
Good
is a
luck.
real. Oh my God, Instagram is not my friend, never my friend. But thank
Thank
you for your
you.
time.
Thank you, Grace. It's lovely to chat with you again.
And if I didn't cover anything, that we can always come back and do another one.
Yeah,
And anyone's got questions, they can definitely DM us, and then we'll help them to, or you will help them to answer. I'm not a doctor.
for
I'm
sure.
just a go with a big mouth. Have a lovely weekend, and thank you so much for this. And
You're
thank you for
welcome.
educating me.
You're welcome. Ciao.
Bye, everyone. Thank you for tuning in, everyone.